Good morning, my dear friends. I want to use this opportunity to address this question that I've always been posed with. The question is, after my cesarean section, can I still give birth vaginally? Well, the answer is straightforward. Um, if you have, and it depends on whether you have had one cesarean section or two or more cesarean sections. If you have had two or more cesarean sections, you are supposed to have a repeat cesarean sections. In fact, once it's a known fact that once you have had two previous cesarean sections, your subsequent deliveries becomes through cesarean section. But if you have had just one cesarean section, there are certain factors we need to consider for we to decide whether you are going to have um, vaginal birth or another cesarean section. For instance, we are going to consider whether you are attending an antenatal care by obstetrician who is supposed to assess you properly. Number two is whether you are going to deliver in a facility with cesarean section services, a facility that has blood banking services, a facility that has adequate resources to monitor you in labor, you know. So, and then also an aesthetic services so that if there is anything that goes wrong during your delivery, during your labor, immediate cesarean section can be done. All right. Now, another other factors that we also consider, include the fact that we are going to assess your baby's weight. I mean, the weight of the baby you're already carrying, whether the weight is greater than 3.5 kg. Once it's greater than 3.5 kg, the chances that you are going to succeed with vaginal birth is low. We cancel you to have a repeat cesarean section. Now, if the reason that you had your first cesarean section is because you have inadequate pelvis, your doctor has assessed you and said your pelvis is small, it won't your baby will not be able to pass through. That means that that factor is still there even in this second pregnancy. That means you are going to have a repeat cesarean section, because if you are allowed to have vaginal birth or trial of vaginal birth, it will not be successful. You still end up having a repeat cesarean. So we are not going to allow you to try vaginal birth in that circumstance. Now, if you had complications in the previous surgery, assuming you had wound breakdown, your wound was deeply infected, and then there was delayed healing in your first cesarean section. In the second pregnancy, we are not going to allow you to have vaginal birth, because a wound that was infected is not likely to have healed properly. So if we subject you to labor, that wound will tear. That wound will tear, and then it will lead to a calamity. The woman can die, or the baby can also, or both of them can die, along the line. So these are important factors that we consider. And again, is if you have a baby's weight of more than 4 kg, ultrasound has said this baby's weight is more than 4 kg, and you are considering whether you are going to have vaginal birth or cesarean section, and you've already had one previous cesarean section, we will cancel you to have a repeat cesarean section, because that delivery is not likely to pull through. So why subject you to the stress of labor, whereas we know that it's not like